Today, only 1/3 of married women in Malaysia use modern contraceptive methods, leaving a 25% unmet need. This gap results in unplanned pregnancies and unwanted births, especially among women in rural areas and with lower educational levels. A key barrier to the use of modern contraception is lack of knowledge. According to recent data, contraceptive use in Malaysia has remained stagnant for the past 25 years, while the unmet need for family planning continues to rise. This highlights the urgent need for change. The prevalence of contraceptive use in Malaysia is 34%. This is lower than in neighboring Southeast Asian countries, such as Thailand, with a contraceptive use of 77.5%, and Singapore, with a use of 55.1%. Malaysia consists of two regions: East Malaysia, located on the island of Borneo, and West Malaysia, on the Malay Peninsula, where the capital Kuala Lumpur is situated. With a total population of 34 million, 22 million people live in urban areas on the peninsula, of which primarily ethnic Malays, but also with significant Chinese and Indian populations. The indigenous Orang Asli people reside on the interior of peninsular Malaysia. Malaysia's population is growing at 1.95% annually, and there is no significant difference in unmet family planning needs between these ethnic groups.
So what is family planning? So family planning is actually when a couple decides of how many children they want to have, if they want to have a children, and if they have decided how many children they want to have, they will decide on the durations of each children. So which means the gap of each children. So when do they want to have the children next?
Two key indicators of family planning progress in Malaysia, aligned with the Sustainable Development Goals, are the percentage of women of reproductive age between 15 and 49 years, whose family planning needs are met with modern methods, and the adolescent birth rate. We will start by looking at the first indicator, on women satisfied with modern methods of contraception. In 1974, Malaysia's contraceptive prevalence rate, abbreviated to CPR, was 26.3%, representing the proportion of women between 15 and 49 using contraception. By 1984, this figure had doubled to 52%, with modern methods accounting for 34.3%. Since then, however, the CPR has plateaued, with the most recent data from 2014 showing no significant change. The number of married women with unmet family planning needs in Malaysia is 4.27 million, while 2.04 million are currently using modern contraception. In Malaysia, sexual activity is generally accepted only within marriage. The gap between married women who do not want more children and those who do not use contraception is 25%. Unmarried women who typically do not want children were not included in this survey, meaning the actual unmet need for contraception is likely much higher than 25%. While there is no disparity in unmet needs across ethnic groups, significant differences exist between urban and rural areas. In Negeri Sembilan, the Kuala Lumpur capital city area, the CPR is 63% and the unmet demand is 14.9%. However, in more rural areas like Kuantan, the CPR drops to 24.3% and the unmet demand doubles to 33.3%. Now, let's look at the second indicator, the adolescent birth rate. Malaysia measures births per 1,000 women aged between 15 and 19 years. In comparison, the Netherlands had an adolescent birth rate of 2.5 per thousand girls in 2019. In Malaysia, the overall adolescent fertility rate is declining, reaching 8.5 per thousand girls in 2018. However, this rate varies significantly by region, ranging from 16.6 in rural Sarawak to 2.3 in urban WP Putrajaya. States such as Pahang, Sabah, Sarawak, and Wilayah Persekutuan Labuan still experience adolescent birth rates higher than the national average and the SDG target of 2.5 births per thousand women. These states have made progress, but additional efforts are needed to reduce these rates further. Despite the decline in the adolescent fertility rate, contraceptive use remains lowest among the 15 to 19 years old. This lack of contraception contributes to a higher incidence of teenage pregnancies in Malaysia, which carries specific health risks, including infant mortality, maternal deaths, long-term health complications, and limited socio-economic opportunities for young mothers. Adolescent pregnancies often result from child marriages or unintended pregnancies among single teenagers, which may trigger child marriages. In 2018, of the almost 1,900 child marriages in Malaysia, more than 1,500 involved girls, 89% of whom were Muslim. The states of Sabah and Pahang recorded the highest number of child marriages. Pahang also had the highest prevalence of children aged 13 till 17 who had ever had sex, at 9.5%, compared to 4.3% in Kuala Lumpur. In these regions, contraceptive use remains low. By 2030, under the WHO's Sustainable Development Goal, Target 3.7, on sexual and reproductive health, all individuals should have universal access to sexual and reproductive healthcare services, including family planning, education, and integration into national health strategies. Access to contraceptives enhances several human rights, including the right to life, liberty, freedom of opinion and expression, and the right to education and employment. Additionally, it brings significant health and social benefits. These benefits include prevention of pregnancy-related health risks for women, especially adolescent mothers, such as eclampsia, puerperal endometritis, systematic infections, maternal death, and pregnancy-induced hypertension and diabetes. Improved infant health by reducing the risks of low birth weight, preterm delivery, and severe neonatal conditions. Increased birth intervals, reducing health risks for both mother and child. Prevention of unwanted pregnancies and out-of-wedlock births. Expanded educational and employment opportunities for women, and sustainable population growth and economic development. The ideal time for women to have children is when the couple wants children, the woman is between 20 and 35 years old, and the last child was born at least 2 years ago, or the woman has controlled medical conditions.
I think if you are become pregnant too early, less than 2 years, I think you are taking your rights as a person to recover yourself physically, and most important is emotionally. You have to take care of small kids, few small kids with very short age gap, and for me it's a stressful condition. That is one. Another thing is, what about the kids themselves? They should get your attention, they should get your love, they should get 100% of you as a mother, but then you couldn't give because you yourself is tired. How you want to give 100% to them?
Currently, the CPR in Malaysia is 55% for all contraceptive methods and 34% for modern methods. The most commonly used modern methods include oral contraceptives, tubal ligation, male condoms, injectables, intrauterine devices, and implants like Implanon. However, 23% of women still uses traditional methods, such as withdrawal or tracking menstrual cycles, which are considered unreliable.
It's actually they are not correctly use the calendar methods. Sometimes they know they should avoid to have the sexual activity during their ovulations. But then when we look at their cycle, sometimes their cycle is a bit longer, so which makes the ovulation time is not same as other individual. So it's a bit not correctly done by the community. So sometimes if I'm seeing such cases, I would advise them for better contraception option.
Yes. Of course, each time mother is delivered, when they have routine follow-up in clinics, we do counsel regarding contraception and stress regarding the importance of contraceptions in each mother.
Long-term contraceptive methods like implants and IUDs are the most reliable. While oral contraceptive pills are highly effective, widely available, and easy to use, they require daily adherence, which can lead to forgetfulness. This is why doctors often recommend permanent contraception. Despite growing acceptance for IUDs, other permanent methods like Implanon have not reached the population. Implanon insertion is not widely available in government hospitals and costs around 500 ringgit, which is approximately 105 euros, in private hospitals, making it unaffordable for lower income groups. Primary reasons for not using or discontinuing contraception in Malaysia include the desire of a child, medical reasons, husband's objection, and the fear of side effects.
What she realized after taking the oral contraception is that her appetites increase, so causing her to have weight gain. So that is one of the reasons why she wants to also change to another method.
So she don't want to try any other method because she has experience with her auntie who previously fixed on Implanon, intramuscular Implanon, and also IUCD. However, her auntie experienced there was extreme pain in the pubic area and unfortunately had to remove because according to the doctors it was already infection. So because of that history with her family, she wants to avoid any other method of contraception.
Factors contributing to lower contraceptive use in rural areas include limited method availability, high costs, limited access to services, particularly for young, poor, and unmarried women, lack of awareness, and cultural or religious opposition and myths. As the use of contraception in Malaysia has stagnated for the past 25 years, and the unmet need for family planning continues to rise, it is time for change. To address this, several solutions should be implemented. First of all, free access to contraception for all is necessary. Contraceptives, including Implanon, should be made affordable and available at government hospitals and clinics, both in urban and rural areas. This will allow every woman the freedom to choose the preferred method of family planning and encourage them to start or continue using contraception.
So far, Ministry of Health government do provide contraception service for free, which means the oral contraceptive and the intrauterine contraceptive device was provided free for Malaysian citizens.
Secondly, improved access to contraceptives is necessary. In East Malaysia, which is more rural, and in large states like Pahang, access to information and specialists is limited, making it harder for residents to access modern contraception. More mobile clinics should reach out to these places to increase the access of contraceptive methods.
Because if she wants IUCD, since the clinic Kesihatan Matunggung don't have any female doctors, then meaning she has to go to KK Tinawang.
Thirdly, Comprehensive sexual education is of huge importance. It is essential to provide young boys and girls with the knowledge and skills to make informed decisions about their sexual health without undermining traditional family values. School-based reproductive health education can raise awareness of the risk of unprotected sex and help prevent unintended pregnancies, especially in rural areas. Children all around Malaysia should be forming the right attitudes, beliefs, and values about their identity, relationships, and intimacy, and learn about all the contraceptive methods available to them, so that they can make decisions appropriate to their needs. This way, unwanted adolescent pregnancies can be prevented.
Okay, once we make her realize that girls can get pregnant once they get their menses, she said then it is appropriate for us to teach about contraception as early as possible, even at 10 years old. For her, at 10 would be an appropriate age.
Fourthly, addressing beliefs and religion. In many Asian countries, including Malaysia, social pressures from spouses, in-laws, and elders can influence a woman's decision to use contraception.
For me, that is minor case. I have seen a patient who's a Muslim. The husband keep on refusing for contraception, but the wife insists to have it because for her, it's her right to space her pregnancy because she need rest, she need time for herself as well in between having another kids.
Pious Muslim especially, they do reluctance in contraceptions because they believe that first the child is a gift from God. So once they have been on contraception, it's like you defy or deny the gift of God. So that's why they're reluctant to have these contraceptions.
However, religious views in Malaysia do not prohibit contraception. The fatwa, the Islamic ruling, also allows contraception for married couples and in cases of rape, mental disabilities, or emergency contraception for unmarried couples. Most religions are not against family planning. And lastly, the employment and empowerment of women. In rural areas, many women remain unemployed and have children at a young age, seeing large families as a sign of prosperity. However, in urban areas, a bigger family is seen as a financial burden. Increased female employment and higher educational enrollment, particularly among girls in rural areas, provide hope for continued progress in empowering women to make informed decisions about family planning.
So I think we have to put more effort on give awareness to mothers, especially plan the pregnancy, become healthy first, then get pregnant.
The things that the government can improve is regarding the awareness. Maybe they can create like a social media page to like advertise the importance of contraceptions, and then correcting taboos that or correcting misunderstanding that the patients might have. I think nowadays is the media social era where the information can easily available. So I think the government should provide a good platform where public can have a proper channels to get their knowledge right.
We need to reach more people. We need to educate our community, especially on emergency contraception. For me, the emergency contraception does help if you educate them correctly.
I think future of family planning would be better. More patients or more population will get a better coverage of contraceptions. It should be better in this coming future.